I hope your time here is both productive and inspiring, and I wish you all the best for a successful conference. Welcome to Minnesota, and thank you.
The past 30 years of science has proven the benefits of managing and preserving a patient's own blood, and yet all of that evidence really isn't getting applied to clinical practice. We were frustrated. We wanted a solution, and we thought that was probably more education and awareness. How do we do that in today's modern era? Let's launch a podcast.
The podcast is an easy way to reach both patients and medical providers who need more information that we have about managing their blood health. Arya, it's so good to see you.
You both look marvelous. What we learn, which is so important, is that blood as an organ is the only one that actually regenerates almost completely.
I'm a physician at University of Rochester. I'm in clinical pathology. I'm the director of the blood bank and director of the coagulation lab at University of Rochester, upstate New York. It's very important to reach out to patients, to public, to let them know about what's patient's blood management about.
Especially in young women, the taboo of talking about menstruation openly.
Blood safety, reactions that they could happen during transfusion reactions. So a lot of this is like more of awareness of what's going on in the hospital, what's going to happen during your procedures, what are your other options.
I've been a nurse for about 26 years. I started my journey as a pediatric cardiac nurse, and I gave a lot of blood, and parents were always concerned, and they would ask me, is the blood safe? And I would say, absolutely, it's absolutely safe. I would never do anything to harm your child. And once I started my PBM journey and I really started learning a little bit more about transfusion medicine and transfusions in general and how they affect the body, I realized that I probably wasn't being that honest. I was misinformed, and it hurts sometimes to understand that maybe what you were doing wasn't the best. You always want to strive to be better, and part of that is education. Educate, have fun all at the same time, and honestly, I mean, this is something that we really need the whole world to hear.
Some of the challenges for any hospitals, regardless if it's a teaching hospital or if it's just like community hospitals, there's a lot of infrastructure has to be established or has to be touched on before initiating such a program.
We still don't have clinical pathways to help follow patients' wishes and to regenerate their blood back on its own, which we can easily do. So that is a problem, a frustration that I know we can fix. And that's why I'm so excited to be working with my team.
Marianne, Sarah, and Majid. I love working with them. We have so much fun together, but we're also aligned on a very important mission to educate and to disrupt the healthcare and change things and make things better and do things right and advocate.
We have been researching and working diligently on a state-of-the-art educational program.
We are just thrilled to be able to create this platform that can be utilized worldwide.
And we're so excited to be able to announce that launch here at SABM 2025.
It's going to utilize AI. It's going to make implementing patient blood management much more successful on such a larger scale.